Hello friends, in this presentation we are going to discuss a very important topic which is important in terms of that it is asked very frequently in ASRB-NET and ARS examinations, be it in gynecology or LPM, and this is the topic pregnancy diagnosis in farm animals. It has immense importance because when we are able to diagnose the pregnancy, that whether it is of how many days or how many months the fetus has become, and if we have this knowledge, then we can easily predict the that whether the fetus is healthy or not, or whether the pregnancy has taken place or not. For first of all, whether it has taken place or not after EI, whether there are signs of pregnancy, or we can detect it by various methods. So it is very necessary that farmers must have the knowledge to diagnose the pregnancy so that they can repeat the AI if the pregnancy is not seen. So we start with this presentation. First, what is importance of early and accurate diagnosis? Because early diagnosis of pregnancy is very necessary so that farmer doesn't wait for too long and performs AI again or natural insemination again. Early detection reduces the calving interval, and if this calving interval reduces, then intercalving period also reduces, due to which the farmers will have progeny in comparatively a lesser time and more milk production during the fertile life of the cattle or buffalo. It also helps it to identify non-breeders. It helps to identify those animals which will not conceive ever. This maximizes productivity and profitability. Also, for herd health, very important for early and accurate diagnosis. Accurate diagnosis allows for proper nutritional management. If we will know that animals are pregnant, we will give extra nutrition. If we will not be able to know, then maybe due to less nutrition, animals may abort. It ensures timely vaccination and reduces the risk of pregnancy complications. Then, what are the methods used for pregnancy diagnosis or PD? Observation, like watching signs like cessation of estrus, that is the most important sign, or we can say most common sign which is seen, that once cattle buffalo is pregnant, it will not go under the estrus. Then palpation, as you can see in this picture, recto-abdominal palpation, manual examination via rectum, done to detect amniotic vesicle or fetal membrane slip. Here the left hand is used to detect the amniotic vesicle. Limitations. These methods have limitations, observation and palpation, that they can be inaccurate. Always a technical person is required to do this, and then inexperienced person can detect false negative results, especially in early pregnancy. Now, which is the most advanced pregnancy used, which gives confirmed result even in early stages, is ultrasound technology. It uses sound waves. They create the image of uterus and fetus, as you can see in the photograph, and it has very high accuracy and gives results in early detection also. And it also helps in predicting whether fetus will live for long or not, or whether there will be abortion, or whether fetus has any congenital disease. Also, it identifies multiple pregnancies. Other tests of blood and milk which can give us diagnosis of pregnancy are blood tests to detect specific proteins in blood. Examples of these tests are PAGs. Milk, in milk also pregnancy can be associated with glycoproteins. If they are present in milk, then we can identify those, and then we can say that there is pregnancy. And biomarkers are also used. They ensure very high accuracy and used in conjunction or synchronization with blood test and milk tests. If we compare the accuracy of different methods, palpation has about 82% accuracy. Ultrasound has the most, which is about it is maybe about more than 82, maybe about 85 or 90%. And then blood test also has accuracy which is lesser than ultrasound but greater than palpation. So ultrasound is the best method of pregnancy diagnosis. Ultrasound provides superior accuracy. Blood tests are also reliable. Palpation can be less accurate. Species specific, in cattle we do ultrasound and PAG blood test. Then sheep and goat, we do ultrasound via transabdominal approach. Abdominal ballotment is done in sheep and goats. And in swine, A mode ultrasound is very quick and early fraud detection. Now, what are the various pregnancy diagnosis programs? Dairy farm, in real world, dairy farm reduced calving interval by 20 days using ultrasound. What happens? What are the advantages? 20 days calving interval is reduced due to ultrasound. This helps in increasing productivity of the farm. Then beef operation, identified and culled non-pregnant cows early, saving feed cost. If we know that pregnant cows are not there, these cannot become pregnant in future, then we can easily cull them so that we can save our feed cost. Smallholder improved reproductive success. This was done by implementing blood tests. If we uh, do blood tests, and these were done earlier also, and from them it was detected that whether animals are pregnant or not. Basically, all these three things: dairy farm, beef operation, and smallholder, these all three things were found that it had, these were the advantages the farmer had in all the PD programs that were done around the world, and then these three advantages for the farmers were seen. What are the challenges and future directions in diagnostics? Cost should be affordable to the farmer. It should not be very expensive. Accessibility, it should be accessible. It should not be like that only to farmers of big cities or big areas of developed countries are getting such technologies, and not the developing nations. And accuracy is very paramount, because if the results will be false positive or false negative, then when this pregnancy diagnosis cannot become accurate, and then farmers will have many problems. More accurate biomarkers should be used. Now, what are the conclusions that we can draw from this presentation? Early and accurate pregnancy diagnosis is essential to provide economic and herd health benefits to the farmers, and we should encourage now the use of modern technologies like ultrasounds, and these technologies will optimize the reproductive management practices. So I hope that now it is somewhat clear what is pregnancy diagnosis and how it is done. It is very important topic for log answer in ARS as well as objective types in uh, NET, ICAR, ASRB, NET to 2025. If you have any questions, you can put them in the comments, and do follow, do subscribe this channel for more videos. More videos are going to come on different topics till the ASRB exam is there, and then share this video, like this video, and subscribe the channel. Thank you so much.